Whenever we talk about cancer, this is what I tell my patients. First thing you need to know when you suspect cancer is what are we dealing with. So you find out what we're dealing with by getting a biopsy. So you stick a needle into it, get a pathologist to look at it under a microscope. It'll tell you, okay, this is what we're dealing with. The second question, how much of it are we dealing with? So the way we tell how much of it we're dealing with is by scans. In particular, this is a picture of a PET scan. So this patient has a solitary nodule in the lung, no cancer anywhere else. So on a PET scan, cancer lights up like this. It's a specialized dye that they give you that has a marker attached to glucose. So when anything in the body that's rapidly uptaking glucose will light up. This glucose marker lights up other parts of the body as well. So the heart always lights up on the glucose marker. We're a little bit above the heart on this image, but the heart always lights up. The brain always lights up. So a PET scan will not tell you what's going on in the brain. It'll only tell you what's going on in the body. So we usually do a PET scan. We usually do an MRI of the brain. That'll give us an idea of, okay, this patient does not have cancer in the brain, doesn't have cancer anywhere else, has this one spot. We want to also get a biopsy. So there's multiple different ways we can do that. We can do what the picture shows here is a navigational bronchoscopy, which is it's a bronchoscopy in which the pulmonologist, the lung doctor, has a little remote control, like a gaming thing, and the bronchoscopy guides. It's navigational. The machine will say, turn right here, kind of like navigation. And you turn the robot to the right, to the left. It'll take you down to exactly where the cancer is, and it'll biopsy it. It's a pretty cool thing. So this is another way we can do biopsies. Now, if something's too far, too difficult for the navigational bronchoscopy to get to, we do a CT-guided biopsy. So they put the patient in a CT chamber, get a CT, and then put a needle and then guide the needle using CAT scans to get exactly where the tumor is. And you can see our interventional radiologist is getting the needle right into the tumor so we can get a biopsy.